Do you dread putting on that bathing suit for fear that your stretch marks will show? Are you constantly struggling to get back into your pre-pregnancy jeans? Motherhood brings about endless joys, but the effects of pregnancy on the body can sometimes be drastic. Whether your pregnancy has created a tummy bulge that won't go away or drastically changed the size and shape of your breasts, there are a host of solutions available to help you get back to feeling and looking yourself again. After giving birth, proper diet and exercise may not be enough to get your pre-baby body back. Many plastic surgeons are offering what they call the Mommy Makeover, which often combines a tummy tuck, breast augmentation or lift, and liposuction to tackle post-pregnancy body concerns. Before moving forward with any cosmetic enhancement, there are some basic guidelines you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one who is actually board certified in plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. Once you've selected the right doctor and have established your expectations, it's time to explore your procedure options. A tummy tuck takes care of all the abdominal issues experienced by post-pregnancy women and also gives surgeons the ability to bring in the waist like a corset. Depending on the extent of your particular issues, there are a variety of tummy tuck options that treat different degrees of muscle and skin laxity. The three main post-pregnancy breast concerns are stretch marks, sagging, and loss of volume. Your concerns or combination of concerns will dictate which type of breast enhancement surgery is best to restore your pre-pregnancy breasts. With weight gain during pregnancy comes fat that may stick around long after you've delivered your baby. To treat areas of fat that are unresponsive to diet and exercise, liposuction is the go-to treatment. While liposuction won't change the texture of the skin or repair damaged muscles, it will permanently get rid of fat pockets, especially in the stomach, hips, waist, thighs, and butt. For most women, stretch marks are an unfortunate side effect of pregnancy, and despite all of the advances doctors have made, there's still no cure or surefire way to prevent them. Some doctors report that a series of intense pulsed light treatments or fractional resurfacing can improve the appearance of stretch marks. Doctors usually recommend waiting 6 months post-baby before considering surgery in order to give your hormones and your body a chance to return to normal. You should also wait until you're done having children in order to maintain the results for the long term. While multiple procedures are a great way to take care of the biggest post-pregnancy complaints at once, it's important to remember that combining procedures leads to longer surgery and recovery time and potentially a greater risk of complications. There are many procedure options available and new treatments being developed constantly, so a comprehensive exam and personalized consultation with your plastic surgeon will determine what's needed to achieve the best possible results for you. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Establishing the look that's best for you is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule. Don't forget to ask these questions during your consultation, and don't be afraid to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want and, more importantly, what you don't want. Once all of your options are discussed and your questions are answered, it's time to book your appointment.